In order to understand tramadol addiction, we first have to understand what tramadol actually is. Tramadol is an opioid medication typically prescribed by doctors to treat mild to moderately severe pain. As one of the top 50 most prescribed drugs in the United States, more than 19 million people hold prescriptions and use the drug nearly every day. As an opioid, tramadol is also highly addictive and is abused on the street as well as many of the people with prescriptions. Individuals without proper long-term monitoring may find that they become tolerant, dependent, and then addicted to their prescription pain pills. As a result, an estimated 2.1 million Americans are addicted to prescription painkillers like tramadol. Tramadol is an opioid drug sold under brand names like Ultram, Ultram ER, Conzip, and Ryzolt. As an opioid drug, tramadol interacts with the opioid receptors in the brain, causing releases of dopamine, serotonin, and opioid interaction, or effectively triggering the brain's reward system. Over time, the brain will adjust to increasing levels of this opioid, which reduces the effect. This is known as tolerance. Individuals often simply increase their dose to maintain the effectiveness of the painkiller. Eventually, dependence occurs, where the body goes into withdrawal when the drug is removed. Individuals may be addicted to tramadol if they take or purchase tramadol outside of their prescription, combine tramadol with other non-prescription drugs or alcohol, hide their drug use from others, show drug-seeking behavior, such as stealing, take tramadol in instances when it could be dangerous, such as before driving a car. Tramadol is a central nervous system depressant, which effectively slows the heart and lung functions when active. During normal prescription use, this effect is moderate. However, individuals with a substance use disorder often take many times the original prescription dose. Individuals on a high dose of tramadol will typically show signs including clammy skin, slowed breathing or respiratory problems, sleeplessness or lethargy, pinpoint pupils, slow heart rate, low blood pressure, weakness, seizures, and even coma. Tramadol is a heavy depressant when taken orally, meaning that individuals can experience massive sedation when high. Rather than the euphoria of other opioids, tramadol causes excessive sleepiness and relaxation, which can result in a coma and even death. If your loved one is high on tramadol and unresponsive, you should call emergency services to prevent overdose-related fatalities. Detoxing from tramadol is often more difficult than detoxing from a standard opioid such as hydrocodone, simply because withdrawal symptoms are more complex. Individuals can expect a relatively severe detox process, which should be medically monitored to prevent complications and self-harm. During the detox process, most individuals experience nausea and diarrhea, muscle aches and pains, hallucinations and sensory hallucinations, paranoia, anxiety and panic attacks, confusion or disorientation, mood swings, irritability, and depersonalization. In most cases, individuals will experience a sudden onset of cold and flu symptoms such as headache, nausea, and runny nose and eyes. You'll also likely experience cravings fairly early on, from the early onset of symptoms. This is typically within about 24 hours from standard tramadol and within 72 hours for slow-release tramadol. These symptoms can typically last for 5 to 7 days and then begin to taper down. If you or a loved one think you are struggling with tramadol addiction, call us 24/7 at 844-330-0096 or visit us online for more tramadol addiction information at southcoastcounseling.com.